Well, when you have a sexual contact, it could be either sexual intercourse or sexual outercourse. Sexual intercourse means there's penile penetration. It could be oral sex, which is a form of sexual contact. So there are infections that are transmitted through sexual contact, and they could be caused by bacteria, viruses, or parasites. The common bacteria that cause STIs are gonorrhea, chlamydia, and syphilis. The common parasite that causes STI is a particular infection called trichomoniasis. And the common viruses that cause STIs are HIV, human papilloma virus, which we call HPV, herpes, and hepatitis B. Now, I'll just quickly talk about the general symptoms of STIs. How do you know? How do you suspect sometimes that you might have STI? The number one thing is you might not have any symptoms at all. And that's why we use the term STI, sexually transmitted infection. In the past, we used to use the word STD, sexually transmitted disease. But the problem is when you talk about disease, you expect to see symptoms. So we changed the nomenclature to STI, sexually transmitted infection, because there are some STIs that have no symptoms, such as chlamydia. Another thing that could occur or that could make you suspect that maybe you have STI is vaginal discharge. Whenever you have a vaginal discharge, there are 3 questions to ask that the doctor will ask you. What color is it? Is it itchy? Is it offensive? From those 3 questions, he'll be able to know in which direction the STI is coming from. For example, if the color is white, egg white, and is itchy, he will be thinking in terms of candidiasis or thrush. If the color is yellowish green and it is very offensive, fishy, offensive, he'll be thinking in the terms of trichomoniasis. Other symptoms include things like penile discharge, painful urination, which I'm sure a lot of people that have had gonorrhea, especially men, would understand what it means. Painful urination. Sometimes you have sores or bumps in the genital area, abdominal pain, fever, rashes, and sometimes the lymph nodes are enlarged. What are the risk factors that could make you have sexually transmitted infections? The number 1 risk factor is unprotected sex. The second risk factor is if you have multiple partners. A third one is if you've had a history of STI in the past, the tendency is you could have it again in the future. Another risk factor is if you've been sexually assaulted or you've been raped. Others are things like excessive alcohol abuse, excessive drug abuse, being too young, and strangely, there's something, men who have erectile dysfunction and who are on drugs are actually a risk factor. I will explain that later if time permits us. So how could you prevent yourself from STIs? The best way of preventing yourself or prevention from STI is to abstain from sex, if you can. And if you can't, to have only one partner. Other ways are, if you are meeting a new partner, it's always better to wait and do a test with this your new partner. I know it can be sometimes difficult telling a new partner that we need to check ourselves and see before we start making love, but it's always safer. Another way of prevention is to get vaccinated. There are actually some STIs that you can get vaccinated against. Some of them are hepatitis B and human papilloma virus. The use of condom is a very good preventative method, especially for men and even for women. And the other thing is, it's important to go for regular sexual health check. Other forms of prevention include avoiding alcohol and drug abuse. What they do is they make you lose your senses, and then you engage in risky sexual behavior. Communication with your partner is very important, and it's also been found that male circumcision protects men from certain STIs. So who are the people that should be having regular STI tests? That is, they have to keep going for checks at regular interval. If you know that you are sexually active and you are less than 25 years old, it's better you go for regular STI test. If you are meeting a new partner, it is advisable that both of you go for STI test. If you engage in men-to-men sex, it is advisable that you have regular STI test. If you are HIV positive, it's also advisable that go for regular STI test. And the reason for that is, in HIV, you are already immunocompromised. So you are open to more of the other STIs. If you've been raped or sexually abused, it's also important that you go for STI test. That's an overview again, quickly, of what STIs are. I'm rushing a little bit, but I want to quickly cover as much overview as possible so that we can have time for the questions and answers. I hope you're all still hearing me.
Yes, we are, Doctor. Yeah.
Okay, good. So I'll quickly have the overview of the menopause, then we can go on to questions and answers as quickly as possible. Menopause basically means the end of the menstrual cycle. And this usually happens on the average at age 51, plus or minus 4 years. So in some women, it could prolong up till age 55, whereas in some other women, it could be earlier, as early as age 47. Menopause causes a lot of physical and emotional symptoms, which I'll talk briefly about very soon. But the question is, what causes menopause? It could be caused by 4 things. It could be the natural decline of reproductive hormones, which is a function of age. By the time you reach age 50, 51, your hormone starts decreasing, and eventually it results in menopause. It could be as a result of hysterectomy and the removal of the ovaries in a woman. The third cause of menopause could be if you are having chemotherapy or radiation therapy for cancer. What they do is they knock off the ovaries. So the ovaries cannot produce estrogen again, and people go over into menopause. Another cause is what we call premature menopause. And this normally happens in women aged less than 40 years old. If you are less than 40 years old and you have achieved menopause, then you have what we call premature menopause. The symptoms of menopause are this. The number one symptom is your period. You've missed your period, or you've not seen your period for about 6 months to 1 year. Other symptoms that come with menopause has to do with the decreased estrogen, which is the normal female hormone. When the hormones get decreased inside a woman's body, it causes a lot of symptoms, especially during menopause. So the symptoms are, you've missed your period, you could have vaginal dryness, you could have decreased libido, you could have what we call hot flushes. That is, suddenly you just feel hot. You could have what we call night chills or night sweats. A lot of women who are menopausal have sleeping problems. They suffer from insomnia. You could have mood changes and irritability. You find a lot of women, they don't understand what's happening to them. They get weepy easily. Sometimes they put on excessive weight gain, and they might even notice that their hair is getting thinner and thinner. Most of the symptoms of menopause has to do with the sudden drop in the estrogen in their system. And the sudden drop of estrogen in the system could cause some problems. Women who are menopausal are at a higher risk of having what we call cardiovascular disease. Because what estrogen does in the normal reproductive years is it protects the heart of a woman. And if suddenly estrogen drops, it increases the risk that they might have cardiovascular disease. Another complication is what we call osteoporosis. That is the thinning of the bones of women. So you might find a woman who is menopausal complaining of bone pains. Other things are their sexual function is affected because there's a lot of dryness. They might have decreased libido. They might have what we call urinary incontinence. Urinary incontinence means they can't hold the urine, and then they might realize that they are putting on weight. Menopause can easily be diagnosed by the symptoms and by some blood hormonal test. When you do the hormonal test, what you find there is the FSH, which is the follicular stimulating hormone, is excessively raised. And the estrogen of the woman is excessively low. So when you combine the symptoms with the hormones that is raised, then you can reach a diagnosis. Sometimes we check another hormone that is called thyroid hormone. The reason we check that is a lot of the symptoms of menopause are similar to a lot of the symptoms of low thyroid, or when people have low thyroid hormones or hypothyroidism. How do you treat menopause? One of the best ways of treating it is to place a woman on hormone replacement therapy. What hormone replacement therapy does is it gives symptomatic relief to the woman. It is not, and it's usually used for a very short time. It's not very advisable that a woman goes on a long-term usage of hormone replacement therapy. And the reason for that is it's been found that there's a slight risk of breast cancer and cardiovascular disease. Women whose most problem are vaginal dryness can go on vaginal estrogen. And it's also been found that in some women, low-dose antidepressants, especially the ones in the group of SSRI, that is selective serotonin reuptake inhibitors, such as Prozac, has been found very helpful in such women. Then you have other drugs like gabapentin, clonidine, vitamin D, and calcium. For some women, just pure lifestyle approach can help with their menopausal symptoms. What we mean by that is relaxation techniques, pelvic floor exercises, taking balanced diet, regular exercises. Some people have even found that yoga or acupuncture and sleep help them. So that's a general overview of the three topics. I quickly ran through them. They have their myths, and they also have the facts from the myths as well. I don't know whether you want me to continue with the myths and the facts before we go on to the questions.
I think we can take some questions, because I know some of the questions will also lead you to maybe some things you actually want to tell us. So we just take questions because we have loads of questions actually.
Okay, that's fine. Okay.
Yeah, just to say this, thank you so much, Dr. Okewale, for that amazing